I'm very happy to welcome Amerigroup here. As many of you know, through the Career Management Center, we have a terrific relationship with Amerigroup. We've sent many interns there. We have individuals employed there both out of the undergrad and at the MBA level. Today we're very happy to have Suzette Valentine here. She's the Senior Vice President for Provider Lifecycle Management at Amerigroup. She's got 15 years of experience in project management and technology and 10 years of experience in healthcare. Prior to Amerigroup, she was with Systems Management American Corporation, where she created and led a rapid development solutions unit that partnered with clients on large-scale technology implementation. She's from Los Angeles, California, so a West Coast girl from over on the East Coast, but you've been on the East Coast for a while now. And I like this, I love this quote, so I'm going to do, what does she enjoy most about her job? I love my work because it allows me to help create new solutions, solve problems, and help the members of my team grow and stretch their careers. And that's a really great quote for anybody that needs to work under a manager, that's for sure. That's a terrific quote. So without any further ado, let me introduce Suzette Valentine from Amerigroup.
All right, so we'll see if I need this. I don't know. What do you think?
No.
No? No? All right, good. Okay, good. So we have a few slides. I'll show you something in a few minutes. I kind of like to walk around, but I don't like to stand in the light, so this is probably going to work. Hi, as Dr. Filer said, I'm Suzette Valentine. I've been at Amerigroup about 9.5 years. And I was only in healthcare a year or two before I got to Amerigroup. But I thought, I don't know how much you know about healthcare, other than you probably, hopefully all have insurance. And other than that, you may not know much about what we do. So there's a few slides on the company, and I'll get to this. But I thought maybe what would be helpful is to try to draw you in a little bit to what's going on in the healthcare industry right now. And why is that an industry that might be a good place to position your career? If you think about it, we as a country, we kind of like reality TV, don't we? I don't, but people in general do. Survivor, American Idol, Extreme Home Makeover, whatever the shows are. And in healthcare right now, we're starting to go through a bit of an extreme makeover. If you think about healthcare in general, health plans, insurance companies, and providers have been pretty adversarial. It's very negative, there's a lot of conflict, you don't pay my claims right, you won't let me offer services. And over the years, that's how people thought about insurance companies, as companies who got in the way of doctors taking care of their members. And at Amerigroup, we really pride ourselves in being a very different kind of healthcare company. We are not a commercial insurance company. We work for state governments who are trying to offer a safety net of healthcare to citizens that can't afford their own health insurance, to citizens that make below the federal poverty level in most cases. And our job is the opposite of trying to prevent them from getting care. The states have entrusted us to help the members get healthier and to help states save money in the course of doing that. And so when I say an extreme makeover, what I mean is, if once upon a time an insurance company's job was to say, I don't think this procedure is necessary, I don't think that procedure is necessary, and no, I won't pay you for this and this and that. Today our mission is, it's quite different. The states that hire us, they're looking for us to prove to them that if they sign contracts with us, that we're going to make their members healthier, and they challenge us to prove to them that our members are going to get healthier. But how would we do that? If any of you in the audience had diabetes, and I had to take care of you, or you had, better yet, asthma. You had a son or a daughter or yourself, and you had asthma. There's two things that can happen. One, you don't manage that asthma, and you go to the ER, and you don't take your medicines, and you have all of these episodes that run up costs, that keep you unhealthy, that keep you in the emergency room. And you have another scenario where you take care of yourself, you take your medications, you're examined on a regular basis, and not only are you healthy, but you're not in the ER, you're not running up the same kinds of medical expenses. But the difference between those two worlds, someone who takes care of themselves and who's healthy in managed care and someone who's not, it can't just be up to the member, because in the populations that we take care of, the poor and the at-risk, they often don't have a great history. They don't have great health histories. They don't have great habits of how to be and how to stay healthy. And so where Amerigroup and companies like us come along and changing the way the industry thinks, is it's our job to look at these members, to understand them. Who's asthmatic? Who's diabetic? Are they taking their medications? What are the things that they should be doing preventively to get healthier? I'm not a clinician, but I've worked in healthcare for 10 years, and we live in the healthcare industry, we live in a place full of data, full of numbers, medical costs, clinical data, quality data. And the change that's going on is it's not our job to prevent access to care anymore. It's our job, we get rated now, our success gets rated on how good a job we do at figuring out what it's going to take for members to be healthier than they are, so that that member takes care of the child that's asthmatic. They do that preventive care, they fill those prescriptions, because every time we keep a mom from having to take her child to the ER, not only is their health better, but we save the states an awful lot of money, because it's a lot cheaper for that mom to take care of their child with an inhaler at home than it is spending 6 hours in an ER in a county hospital. And so again, when you think about our industry changing, for us to do that, who do you think you might trust more, your doctor or your insurance company? Doctor. Lots of you laugh, right? It's a silly question. So Amerigroup might have a really lofty goal, but chances are they don't want to hear from us. They want to hear from their doctors the care that they need. So I'm going to go back to where I started, this adversarial relationship, doctors against health plans. If we need our doctors to help our members get healthier, then do you think it's going to work if we have an adversarial relationship with our doctors? They can't really help us, right? So if you think about it, Amerigroup, we've got all this data, we have wonderful IT people, we have wonderful informatics and data analytics people who mine all of this data. They look at claims history, what kinds of care did our members get? They look at pharmacy data, did they fill the prescriptions that they needed? They look at clinical assessments of how healthy that member is. And they churn through all of this data, and out of these mounds of terabytes of data, they produce insights. And those insights are really great. They tell us things like, a term I'll introduce to you, things called care gaps. A care gap means you need something done to stay healthy and you haven't done it. If you're diabetic, you need an eye exam once a year. If a year's coming on and you haven't had it, you have a care gap, something that's getting in the way of you being healthy, a risk. And so we do all of this great work and we have all of these great insights, but up until this point, we've only been partially successful. We've been much more successful than many of our competitors, but we've still only gotten part of the way to our goal, because it's still only a health plan trying to get a member to change what they do. So the area that I work in, provider lifecycle, one of our biggest missions right now, and it's very leading edge in the industry, is to fundamentally transform the way health plans work with providers. And so think about it for a minute. If you were a doctor and I said I was going to pay you every time a member came to see you, and you had a sick member and they were going to come and see you 6 times in a month, and I said, I really want you to help them get healthier, so they only come and see you twice. What does that mean to you financially? If you get paid per visit, what does it mean?
Much money.
Right. So why would you do that? Would you do that? Probably not, right? So that's exactly where we're at. In our industry, we call it fee for service. We pay doctors for volume today. If you see a member 5 times, you get paid 5 times. Well, then why in the world, how in the world am I going to incentivize a doctor to help me get this member healthier, which helps all of us? How do you think I might incent them? If you were the doctor, what would I do? What would I have to do to have you help me get that member healthier?
Would you give them an incentive for their patient being healthier?
Absolutely you would. You would give them a cut. You would give them an incentive, a financial reward that says, so now the rubric for how I'm going to score you, doctor, isn't just I'm going to pay for volume. I'm going to really shift the way I think of you as a doctor, and I'm going to say, I'm still going to pay you per service, But here are these quality measures. Things like, here are your diabetic members, and if every one of them gets their retinal eye exam this year, you're going to get a bonus. Well, now do you have an incentive if that reward is big enough to make sense, financial sense? Does that make sense to you guys? That sounds small, but it's huge. It's huge. In the industry, we call it aligned incentives, right? If I don't put my money where my mouth is, then what's the point? I can talk all day long about better quality. I can talk all along about bending the cost curve and not spending 20% of GDP on healthcare in this country. But it won't matter if I don't find a way for it to make financial sense. Our job isn't to put doctors out of business. Our job is to figure out how to spend less and still get better outcomes. Because at the end of the day, if we're all healthier, we will spend less on medical costs, right? So I don't need doctors to make less money. I need them to be rewarded to keep you healthier. And so the program, one of the programs that I lead at Amerigroup is called Provider Collaboration. And it's about just that. And it starts with things like putting your money where your mouth is. Say, I'm willing to define a scorecard, a quality scorecard, so that if you achieve certain levels of health, certain levels of clinical interventions for the members that need certain care, that I'm going to reward you. Then I have to use all that data that I talked about, and I have to tell you how you did, right? Because how good is it if I hang a carrot way up here, and I wait until the end of the year to say, sorry, you didn't reach it? You might be unhappy with me, right? You might not collaborate anymore. So I have to have a carrot, and then I have to tell you how you're doing along the way. You guys get progress reports right over the course of the year. Your teacher doesn't tell you you failed at the end of the year, you'd be pretty unhappy with them. So we have to do that. But what about, I take that carrot and I tell you, you're not getting there, you're still not getting there. What else do you need? What else might the doctor need? They might need help, right? They might need to figure out, how in the heck do I reach the carrot? Where's the ladder that I climb to reach that carrot? And that carrot is my bonus. So doctors have worked in the healthcare industry. Doctors have worked in practices that get paid for volume, right? You see me 6 times a month, I get paid 6 times a month. They don't necessarily call you and say, you haven't seen me this year for your eye exam. They're not in the business of doing that. They're not necessarily in the business of saying, Caleb's going to come in next week, and I realize that Caleb hasn't had these 3 tests for hypertension. While he's here, we better be sure to order those labs. That's not the business they've been in. The business, that business is called population management. It's not just paying for volume anymore. Our industry is changing. It's not just go see them 6 times, see them for whatever they were sick for and nothing else, and think that they're going to get better. They don't. That's the take 2 aspirin and call me in the morning mentality, right? That's not the mentality that says I came in for insomnia, but I had these 3 other things, and I took care of them while you were there. So when I say that our industry is going through an extreme makeover, it's not an overstatement. It really isn't. All of the big players, and we are what you call a pure play. Amerigroup is a pure play in the Medicaid space. The majority of our business is taking care of individuals in that safety net. The government is paying for their health insurance, and they've asked us to take care of them. But the bigger players, the commercial health insurance companies, United and Cigna and Humana and so forth, they're doing this stuff too. They're probably only 6 to 9 months ahead of us. We're not very far behind them, and we're certainly not at the back of the pack. But this whole industry is changing. Has anyone heard the term ACO in the newspapers anywhere? Accountable Care Organizations. Anyone heard that? Just another thing coming. ACOs is just another way to say we want doctors to profit from people getting healthier. We don't just want the insurance companies to profit. There's a sense that if people get better, insurance companies are the only ones that are going to make more money, and it'll never work that way. So I say all that to say this is a space that's changing. None of you probably could have missed the news. Supreme Court, that we're hearing the Affordable Care Act. Will it stand? Will it not? Whether it stands or doesn't, and we sure hope that it does in many ways, but whether it stands or doesn't, health insurance has to change. For us, it's wonderful to have the best healthcare system in the world, but to spend 20+% of our GDP on healthcare is a problem. and it's growing. And we have to figure out a way to change that. Because think of all of the other investments we could be making as a country, whether that's covering the uninsured or investing in schools and infrastructure and other things, innovation, technology, R&D. If we continue to spend more and more of our country's budget on healthcare with no better outcomes, how much better off are we? So the industry is compelling right now, and I say that to you because there are lots of places to go in companies like Amerigroup, whether it's financial, or it's marketing, or it's product development, or government relations, or operations. Every area that I mentioned is involved in this transformation of our industry. It's not something that the provider unit does, or the enrollment unit does, or the product unit does. So I say all that to say it's an exciting time to be in healthcare. It's an exciting time to be at a company like Amerigroup that isn't just catering to the general commercial population and losing membership because companies can't afford to pay for insurance for their employees anymore. We happen to be uniquely positioned in a space where our customers are the government agencies that are paying for more and more of the health insurance in this country, and that if the Affordable Care Act stands, will cover even larger a part of our population. And Amerigroup has gotten good, very, very good over the years at taking care of these at-risk members. We do it better than anyone else in the space. We know how to come alongside them, go into their homes, assess their health, figure out what they need, and come alongside and make sure that they get that care. But for all those people that go into members' homes and do that, there's an awful lot of us behind the scenes in the back office making that operation work so that that clinician can go into that member's home and understand what their needs are and execute on all of those needs. So it's a very diverse organization. I'm going to, in just a moment here, I'm going to pause for questions, but I'll go through a few slides about the company. But mostly I just wanted you to get grounded in the place that we live. It's not just about paying claims. Certainly that's a part of it. You know, we have a very large claims organization and lots of IT systems that do that. But the work that we do is about helping members improve their health and saving the state's money in the process. And for people who want to be a part of that, Amerigroup is very mission driven. We're all here. If you looked at any associate survey that we do, and we do them every 2 years, upwards of 90% of the company says the greatest reason they're at Amerigroup is because it's a mission that's bigger than ourselves. We're here to help people that need that help, that can't afford health insurance, that don't necessarily understand how to take care of the conditions that they take care of. It's a very worthy mission. It resonates with all of us. And again, for us to take it to the next level, it's going to involve us working with the providers in our health insurance network very differently than we ever have. So I think our main goal, my main goal for coming here today was to make sure that as a community, that the ODU community has a very good sense of who Amerigroup is. You know, we're in the Fortune 500, we're right in your backyard, and I'm not sure historically that the ODU student population has fully appreciated this company down the road, or that we have fully appreciated the talent that's at ODU. So I think this getting to know you in this set of sessions to try to give you some look-sees into our company, I think they're useful for us because we get to hear and see and hopefully meet some of you and see what kind of talent ODU has to offer. And at the same time, you guys get a peek into what Amerigroup does and how we're wired and what we're focused on and so forth. So before I do the slide on just the company background, I'll pause for either questions or comments or observations.
How does the Affordable Care Act affect or align with Amerigroup's goals?
Yeah, good question. There's a couple different things that happen in the Affordable Care Act. There's lots of them, but to simplify hundreds and hundreds of pages, it establishes a health insurance exchange, right? And if we think about the exchange, the point of that exchange is to cover even more people in the country with health insurance than have it today. By all accounts, most of the states are going to leverage programs like their Medicaid programs to help them run these exchanges. So we feel we will absolutely play and have the opportunity to garner even more members if the exchanges continue and if the exchanges roll out in the markets that they do. I'll say a large part of the members that of the population that would get their health insurance from the exchange are poor and uninsured today. And those are the populations that we are best at taking care of versus maybe some of the bigger commercial counterparts. Yeah, so I would say we're very well positioned on the exchange front, but there are also a lot of other interesting things coming out. Another important part of the Affordable Care Act is growing the Medicaid program. The very programs that we're in, that's 2 million members plus today. So we'll naturally benefit pretty significantly, even if the exchange never came to pass, just by an expansion of the Medicaid programs. So well positioned. Other questions or comments or observations? This is your chance to also show us the talent in the room, so I'd encourage you. Yeah. No pressure.
A good
Yes.
portion of us in here are accounting students.
Yes.
What do you have to offer as far as jobs for our field?
Yeah, that's a good question. I would say certainly there's accounting proper, and then I'm going to answer it a little more broadly than accounting proper because I don't sit in that specific division. We certainly have a corporate finance and accounting division. But I'd answer more broadly, and I say this, I mentor in our leadership development program, and I've said to many LDPs that I have mentored that no matter what your degree, if an accounting degree brings you financial acumen, if it brings you analytic skills, just picking those two skills as an example, I can't think of a department at Amerigroup, not many, maybe clinical, that you need extra distinct skills, that doesn't highly value financial insights, financial acumen, and analytic skills. So I think for those that are squarely looking to use their degree in accounting, it's a wonderful follow-up, and I'm sure that if you went out to Amerigroup's site, you'd see all of the financial and accounting positions. But I would say the answer is much broader, that if you think of the degree that you pursued as one that is an area of interest, but that has a set of skills and competencies that are broader maybe than just a role in an accounting department, then I think the opportunities are very, very broad. We have roles like operations analysts, for example, all over our company, in health plans and at corporate, that solve business problems every day. We're a very data-driven company. We do a lot of Six Sigma projects with lots of financial insights. We look at ROI on corporate projects on a regular basis. So people that bring that financial training and mindset are an important part of the organization, far beyond when we put them in accounting or finance proper. So I'd encourage you to think of that degree as a jumping off point for lots of financial analytic needs. Yes?
Yeah, so the average provider that's operating by themselves, and you offer them that bonus, what is the net return to them? Are they receiving more money by having a fee for service, or they're not getting returns on those, I guess they're Medicaid patients? Do they get more into the bonus structure, overall net amount of money for them?
Absolutely. Yeah, I think.
That's what motivates them to do that?
Yeah, I think there's two things. I mean, ultimately, doctors are in the profession of keeping people healthy, right? With or without money, they do want to do the right thing, but it has to make financial sense. I think, we're in the first 2 years of our very formal quality improvement plan programs. So I think time will tell how we have to calibrate them to make sure that it's the right mix of money to keep them incentivized. But if you think about it, we spend at Amerigroup on average 85 cents on the dollar, on every dollar on medical cost. And all we're talking about is not spending 50 cents, but maybe spending 83 cents or 82 cents. And those couple percentage points is, tens and hundreds of millions of dollars to share back with providers. So yeah, I can't say that I can give you an exact percentage by provider because it varies, but absolutely where we've seen success, where providers can move the mark, they're significantly exceeding the income that they got before if they were just doing fee-for-service. Yes?
I mean, this is a step down.
No, please.
But I was wondering what exactly that diversifies Amerigroup from the other insurance providers. I know you said that you mentioned a couple of companies that are doing the same thing as y'all.
Yeah.
You're catching up with what makes
Yeah, so a couple things I would say. You all, whether individually or through your parents, probably most of you, I hope, have insurance in the room, right? How many of you have gotten calls from your insurance company to make sure that you were taking care of yourself? Good. I see one. That's great. I know you're probably not an Amerigroup member, but that's one. What I would tell you is at Amerigroup, we have hundreds of clinicians across the country. Case managers, disease managers, outreach associates that phone our members, that go into their homes every day. We mine all of this data that we have to find the people that need a little extra help, whether it's because they have uncontrolled diabetes or hypertension or something. And even though we're not doctors, we hire doctors. We have medical directors all over the country. Even though we're not a nursing association, we have hundreds of clinicians. And their job is to help make sure these members are healthy, to connect them with their doctors. So that's one of the biggest things. The other thing I would say that differentiates us from some of the larger commercial insurance companies is they tend to have they tend to build networks of providers that work with them in suburban neighborhoods. We build networks of providers where our members live, in urban communities, in very poor communities, where honestly many of our competitors don't go. They're not strong there, they don't have a presence there, they don't have a reputation there. So we bring the doctors into our network that we believe that our members are going to naturally seek care of. So we've tailored the providers in our network to try to meet the needs of our members also. And then I think, again, like I said earlier, we're trying to collaborate differently with our providers in a whole array of ways. I think the whole industry is starting to do that, and we're right there with them. Other questions? Yes?
I know in the recent decades, doctors attempted, well, some have actually been taking advantage of the Medicare and Medicaid system. And with the government contract, is there some type of the contract with contingencies, or how do they monitor that you guys are not being taken advantage of by certain doctors?
Yeah, it's an important question. We have at Amerigroup, and the states and the federal government have an awful lot of programs and controls to try to find fraud and abuse. We do lots of things. We have third-party vendors that do things like go out into hospital systems and audit medical records to make sure if we see things that look suspect in our data, that we'll ask for copies of medical records and go audit them and make sure that the member really got the care that they needed. We have very sophisticated technology systems that mine all of our data to look for irregular patterns, billing practices, and so forth. And again, then we hire third-party auditors to come in as well. And then the Medicaid agencies have that, and then the federal government has that as well. So there's definitely a very real risk of it, and some of the key controls that we put in place is to try to find it.
How do you relate that information to the government?
A couple ways. Depending upon what it is, there's abuse and there's fraud. And then ultimately there are corporate investigations and litigation. Depending upon what we see, one of the key questions is really the provider's intent. Sometimes people just bill you wrong. They make a mistake. And so when you see a pattern of what looks abusive or what looks fraudulent, we have formal structures. We have a literal corporate investigations unit that does absolutely put states on notice, that can give the states information where the state may then file lawsuits against doctors directly. So whenever we discover and confirm abuse, we're required to report that. Yeah, lots of systems around that. What other questions or comments? Yes?
I know you mentioned about audits and all other reviews and everything, but what about since you're paying the doctors per visit? How about if the doctor asks the patient, that maybe the patient doesn't need a visit, but because they are paid for the visit, the doctor just asks them, or maybe ask them to do some tests if they actually don't need it? Because I've seen doctors they ask you to for a lot of tests that actually maybe you don't even need.
Well,
so how do you have to control that before a fraud or anything? You just kind of prevent that.
It's a good question. I would say a couple of things. You'll hear a lot of numbers in the industries, anywhere from 20 to 40% of all the medical procedures and tests done are unnecessary. Right? And so you're very, very right. I would say that one of the very reasons why provider collaboration, these programs I talked about, are important is because we have perverse incentives, right? If I pay you per visit, you could do things to drum up business that aren't necessary. I would say that the systems are imperfect to find all of that. We do things, there are transparency projects, some companies call them provider profiling, where we look at both a doctor's quality of care and what we call their efficiency of care. how much money do they spend taking care of the same kind of member? And we compare them to benchmarks. How much does it cost this doctor to take care of the same kind of population versus the rest of the doctors in the city or in the practice or in the country? And that is one way. There are efficiency measures that allow us to do comparisons. But to take that one step further, that's what we do today. But to take it one step further, what we want to do is make those efficiency measures another thing that's tied to those rewards. That says, if you're more efficient, if it costs you less money to take care of the same member, not just higher quality, but less money, then your reward is even richer. So we have to turn that problem into an opportunity so that they don't feel the need that just because I have an MRI machine, every member needs an MRI. Right? And it's a very real dynamic. Again, 20 to 40%, I don't know what the real number is, but we have to find a way, and we're all grappling at how collaboration can help us with that in the industry, find a way for the doctors to be rewarded without running that MRI every 5 minutes.
Yeah, because it does change if you tell the doctor you don't have insurance, all the tests they actually before they just go away.
You're very right. You're very right. I agree. Yes, yeah.
Actually, one of the problems that the financial burden of young doctors, I mean, isn't that what they want to get? Is there any way to incentivize that, or why don't you offer scholarships or something?
It's a great question. You know, I can't say that I have a good answer for that one, but there's a lot of discussion in the industry over just the shortage of general family practice doctors, right? It costs so much.
It's not a good return to do it for 20s and then you're in debt a couple $100,000.
It is a very good point. I think there are lots of really interesting ideas on how do we grow our own talent.